What you're going to see right now is a clip of a patient who, after a failed or frustrated attempt to commit suicide by lacerating his pulse, was then given ordered by the psychiatrist to take decanuate, typical drugs, to be given intramuscularly. And the nurses are with him as the medication is being administered. Let's pay attention to the scene. As you may see, the frustrated suicidal attempt made by the patient is indicative of an intense psychosis, which is caused by an excessive dopamine secretion in the brain. And in order to arrest that excessive brain dopaminergic secretion, a typical decanoate drug was then given, and you might have witnessed how powerful that drug is. However, in our previous study, we have learned that the antipsychotic drug will block and stop the excessive dopamine. But in contrary, when it is given, and when the dopamine is deficit, what happens is that there is an excessive tremor from which the patient will suffer from. And this will lead us to the discussion of the adverse reaction or side effects of the antipsychotic medication. The adverse reaction or side effects of the antipsychotic medication, we will call it as anti-HAM. Now, to serve as a good memory aid, let us take a look into what it signifies as a ham. Wow, this is a nice food. However, that is forbidden because that is an anti-ham. This is how it will appeal to our memory when we talk about the adverse effect or the side effects of antipsychotic. Let's remember the word anti-ham. HAM is an abbreviation for the following. One, the histamine. If it is antihistamine, then more likely the patient who's taking antipsychotic drugs will become bigger. He will have a weight gain, and he is so sleepy. He will be having sedation and weight gain as antihistamine. That's letter H. Let's take letter A as an alpha-1 adrenergic. If you are taking antipsychotic drugs, then you will suffer from orthostatic hypotension. That means an immediate change in blood pressure if you are from a supine position and you immediately stand up. A patient taking antipsychotic drugs will usually have a cardiac problem and sexual malfunction. You may be suffering from impotency or an erectile dysfunction. That's why some men are not taking their drugs regularly because they feel they are having problem with their sexual life. And the letter M stands for muscarinic. This muscarinic is what we call as another acetylcholine receptor. And this muscarinic is responsible for parasympathetic effect. However, if it is an anti, it will exhibit the sympathetic innervation, which will include the dry mouth, the tachycardia, the urinary retention, constipation, and blurry vision. Can you just imagine with only one therapeutic effect, that is antipsychotic, versus a lot of side effects. And this is only the first line of side effects that I am discussing right now. Much more to follow in the next slides. Again, when I say anti-HAM, that is antihistamine, anti-alpha adrenergic, anti-muscarinic, this is the type of adverse reaction that are associated with all antipsychotic drugs and with likelihood that it has in no way related with dopamine. Dopamine has no relationship yet with this adverse reaction or side effects. Let's talk about the major adverse reaction or side effect of an antipsychotic medication. And this is what we call the EPS, or the extrapyramidal side effects or symptoms. This is the biggest problem if you are taking antipsychotic drugs. And it is called as the EPS because that simply means it is not happening outside the tract, the spinal tract. I want you to note that from the brain stem, okay, there's a pathway going down to the motor, a descending pathway, okay, and one of the biggest tract is the pyramidal tract, and the EPS or extrapyramidal side tract are those affectations other than the pyramidal. That is called as the extrapyramidal, and these are the extrapyramidal side tracts. This is where the problem is happening. And when speaking of EPS, I want you to remember this code, APAT. That's a Tagalog term for 4. A stands for acute dystonia. P is pseudo-Parkinsonism. Another A is akathisia. And the fourth is tardive dyskinesia. Speaking of EPS, do not forget APAT. Okay. With respect to the onset, this EPS is happening. If it is acute dystonia, it will happen only for hours to days, number of days only, and it will stop from there. However, if there is akathisia and pseudo-Parkinsonism, this may last for days to months. It's quite longer. But the longest of them all will be the tardive dyskinesia, and this will happen from months to years of taking antipsychotic drugs. In our later discussion, we will talk about the details on what is acute dystonia, what is pseudo-Parkinsonism, what is akathisia, and what is tardive dyskinesia. Let's continue with the next slide. What you are viewing right now is a condition called acute dystonia. Now, this condition is so moving. This condition is so saddening and so touching. Can you just imagine you are going to take a medication to alleviate from psychosis, and then after, this is what is going to happen to you. It is like when you're taking medication of antipsychotic, you are choosing between two evils. It's like you choose between psychosis or suffer from dystonia. And this is only one of the 4 EPS or extrapyramidal side effects that may happen to you if you will take antipsychotic drugs. Remember the code APAT. Okay? Acute dystonia is one of the letter A. And acute dystonia is a prolonged painful muscle contraction. Painful. And that is a spasm, stiffness, rigidity of the muscle group of the neck. See that from the neck? There's a twisted head, the tongue, and the face. So there's rigidity, spasm, a very painful spasm, rigidity, and stiffness of the muscles of the neck, the head, the tongue, and the face. And this will produce a condition in which we call torticollis. The biggest problem here is when you are a nurse, you have to you have to watch out for dysphagia. And that is a difficulty in swallowing, definitely. And the laryngospasm, which is life-threatening. Other than that, the client may suffer from opisthotonus. Opisthotonus is an straight arcing of the back and the head. And another worse condition is the oculogyric crisis. And when this happens, there are medications, again, another medications to be given to the client. And remember this, benztropine mesylate, cogentin, that can be in intramuscular form, and the diphenhydramine Benadryl, either in an intramuscular or an IV or intravenous. And this is acute dystonia. What you are seeing right now is a condition called pseudo-Parkinsonism. And in pseudo-Parkinsonism, this is two combined words. The pseudo, which meaning a false, and Parkinsonism itself is a problem in psychiatric condition. It is so called as a pseudo-Parkinsonism because it mimics, or it is a symptoms like Parkinson's disease. However, pseudo-Parkinsonism is caused by a drug-related problem. When you are taking antipsychotic medication, that antipsychotic medication is working against you in extrapyramidal side effects. This is the second of the letter code that we have learned, apat. This is letter A. Letter A is acute dystonia. This is letter P, rather, meaning pseudo-Parkinsonism. Apat. A, now we are talking about P. This is a drug-induced symptoms. You may see here that the patient is having a stoop posture. He is making a gait or a movement called a shuffling or a pastinating gait. Slowly, a small step, pastinating gait. And he is having a cogwheel rigidity. The body is rigid. It's like a rocket-like joints. And if you may notice, the pace is having a mask-like paces. He's having a steep stoop posture. This is the way how we describe pseudo-Parkinsonism. And these words are jargons, and that these words are basically exclusively describing pseudo-Parkinsonism. That's why when you hear the word pseudo-Parkinsonism, you always have to associate the word pastinating gait, cogwheel rigidity, mask-like paces, steep stoop posture. This is exactly how do we describe Parkinsonism, pseudo-Parkinsonism. The patient is having drooling and tremors and bradycardia and bradykinesia. That is slow movement. And if you will look at the fingers of the patient, there is a peel rolling thumb fingers whenever the fingers is at rest. Now, how do you deal with this? The doctor's order will always be to change the medication. If the type of medication, let's say the typical medication has been given, then the physician will resort to a typical type to lower the incidence. And one of the most common drug is an anticholinergic agent called the amantadine. There's a need to lower the dosage, change to a different antipsychotic and administered anticholinergic medication. After discussing all the EPS, we will talk about what are the drugs related to that can help again to ease up all these apat or these 4 types of extrapyramidal side effects. What you're seeing right now is a condition called akathisia. This is the third letter of our code apat. This is the second letter A in a 4-letter word apat. Akathisia. Look at the lady. How will you describe her? She is restless. She's agitated. And akathisia is an intense need to move about. The patient becomes restless, becomes anxious, becomes agitated, and there's a lack of spontaneous gesture. There's an internal restlessness. And that's why most of the patients who's taking antipsychotic medications tends to discontinue the medications because they're not feeling good about the medication. Now, akatisha is easy to remember. From the Tagalog word, akatisha, akatisha, you just say it faster. And it will lead you to word makatisha, makatisha. And in that sense, you will remember that it's running all throughout your body, an intense itchiness that you cannot hold on to. That is akatisha. The third of the four-letter word, akatisha. And in order to alleviate from these side effects of antipsychotic medications, then probably the doctor may change the medication from typical to atypical, and some oral agent, beta blockers, propranolol, and anticholinergic benzodiazepine. These are the medications that will contradict the akatisha. This is the fourth letter of a four-letter word, apat. That is letter T, which describes tardive dyskinesia, or the TD. You are looking into a person suffering from tardive dyskinesia. And this is a syndrome of stereotypic permanent long-term use of antipsychotic medication. If you are using antipsychotic medication for a couple of years, 5 years, 10 years, this is going to be permanent. And syndrome describes a group of symptoms. So means there's a lot that's going on. And the sad story about tardive dyskinesia is that it is irreversible. You cannot change that anymore. This is your life forever. And once you wanted to stop this, then probably you really have to discontinue your antipsychotic medication. But the problem is, you will never be cured from psychosis if you will stop your medication just for the reason of stopping the tardive dyskinesia. Now, as we have described earlier, tardive dyskinesia is a syndrome of, meaning a group of signs and symptoms, particularly including involuntary movements of the tongue. Wow, that's pitiful. The facial and the neck muscle involuntary movement, the upper and the lower extremities, and the truncal musculature together with the tongue thrusting and protrusion. This is very typical when you see somebody who's suffering from psychosis. This is exactly what you're saying. They are making a lip smacking and grimacing, excessive blinking, and unnecessary facial movements. Tardive dyskinesia can be stopped by making a low dose and changing the medication and closely monitoring. This completes the apat, or our code for extrapyramidal side effects: acute dystonia, pseudoparkinsonism, tardive dyskinesia, and akatisha. Aside from extrapyramidal side effects, or the EPS, the apat, and the anti-HAM as the side effects for taking antipsychotic medication, this is considered as one of the emergency situations that can result abruptly after taking antipsychotic medication. And this is what we call the neuroleptic malignant syndrome. This is an anticholinergic side effects of antipsychotic medication. Now, in order for you to easily remember this neuroleptic malignant syndrome as to what are the signs and symptoms, I would like to give you another code to remember by remembering the word fever, F-E-V-E-R, and you can describe what is neuroleptic malignant syndrome. What is happening to the patient is that letter F, the patient is having fever with a temperature of 105 degree Fahrenheit and above that causes rigidity. Fever, letter E, is an encephalopathy. There's something that may happen in his level of consciousness. He may happen to suffer from oculogyric crisis. Fever, letter V, is all the vital signs are unstable. The pulse, the respiration, the temperature, the respiratory rate. And fever, letter E, is an elevated CPK and WBC. And fever, letter R, is the rigidity of the muscle, agitations to four, and the muteness. This is how neuroleptic malignant syndrome is being described. And to stop this from happening, patient is given dantrolene or bromocriptine as a medication. And that is NMS. These medications are what we call the anti-EPS, or the drugs that will treat the extrapyramidal side effects. They are so named based on their generic and trade name, particularly the amantadine, known as the Simetrel, the benztropine, cogentin, biferidine, akineton, diazepam, Valium, diphenhydramine, Benadryl. These are the drugs to treat EPS, and in no way you should not mix it up with an antipsychotic drugs, whether it is atypical or typical. Again, do not mix it up with antipsychotic drugs because these are drugs to treat EPS. Be familiar with the word amantadine, benztropine, biferidine, diazepam, diphenhydramine. Let's add some more. The lorazepam, atibam, procyclidine, chemadrine, the propranolol, Inderal, and the trihexylphenidate are the Artane. These are all either classified as anticholinergic, beta blocker, or benzodiazepine. You may not be able to memorize all of these, but you have to be very familiar with an anti-EPS and antipsychotic medication. The following are the client teaching and the medication management that the nurse must provide to the client. And these are based on the side effects, particularly on the anti-HAM. Whenever the patient is suffering from dry mouth, then you have to give pre-fluids, sugar-free fluids, and hard candies. That would be an anticholinergic effect. And whenever the patient is suffering from constipation, you have to increase the fluid, and the food should be bulk forming. Try and tell the patient to exercise, or if constipation is already there, then you have to give laxatives. For cases of photosensitivity, you may use the sunscreen and protective eyeglass. The client may refrain from excessive exposure to sun, decrease the exposure to sun. And if ever there is an orthostatic hypotension, then tell the client to rise slowly. Do not stand up quickly. He needs to wait for the dizziness to subside. And whenever the client is under anti-EPS or antipsychotic medication that can cause dizziness, you tell the client to avoid driving, nor to operate any machine. And when memory is of concern, then you may use a chart to record the doses to be taken and has been taken by the client. And you may use a pill box to label it to avoid confusion with medication. And finally, you have to watch out for a granulocytosis, especially in the case of clozapine, clozaril. So these are all the basic line teaching and medication management under antipsychotic medication. And here is where we end our discussion regarding antipsychotics. I wish you well in your study of psychopharmacology and enjoy studying.